Hi, you're welcome to Dementia 3. If you haven't listened to Dementia 1 and 2, please kindly do that so that you can understand Dementia 3 better. Today, it will be all about dementia with Lewy bodies. Dementia with Lewy bodies. Okay, let's go. Dementia with Lewy bodies is very close to Parkinson dementia. In Parkinson dementia, the symptoms of Parkinsonism will occur earlier than the dementia. But when there is dementia before Parkinsonism, or dementia occurs at the same time with Parkinson's signs, then it is likely going to be dementia with Lewy bodies. Let me repeat. When someone has been diagnosed with Parkinson's disease and later on develops dementia, that is Parkinson dementia. And when an individual is diagnosed with dementia and later on starts having signs and symptoms of Parkinsonism, or the dementia occurs almost at the same time as the Parkinson signs and symptoms, then it is likely going to be dementia with Lewy bodies. Dementia with Lewy bodies will have the following clinical features. There will be visual hallucinations, seeing strange things that others around could not see. There will be Parkinsonism, cognitive fluctuations, sleep disorders like REM sleep behavior disorder. There's possibility of neuroleptic sensitivity. And dementia with Lewy body, when anyone is diagnosed with that, it is possible the Parkinsonism will be worsened once dementia with Lewy body has occurred earlier. And dementia with Lewy body degenerates faster than the rest type of dementia. Survival in dementia with Lewy body is lower when compared to Alzheimer's disease. So dementia with Lewy body is not good at all when if at all, I could have that privilege to choose between dementia with Lewy bodies and Alzheimer's disease. I would rather choose Alzheimer's disease, though I don't want either, because it's going to degenerate faster and survival is worse. And sleep disorders, cognitive frustration, hallucination, Parkinsonism, and when you give them neuroleptic medication, you worsen the situation for them. So dementia with Lewy bodies. Still on clinical features of dementia with Lewy bodies, fluctuating cognition, features of Parkinsonism like bradykinesia, resting tremor, rigidity. This time around, it will be cogwheel rigidity like it is found in Parkinson's disease, postural instability, autonomic dysfunction with constipation, orthostatic hypotension, urinary incontinence, apathy, and depression. What are the possible investigations to be carried out when you are suspecting dementia with Lewy bodies? The name is from eosinophilic intracytoplasmic inclusions called Lewy bodies in the brain of the affected individual. So we're going to do CT scan of the head, magnetic resonance imaging, PET, and polysomnography for REM sleep. How are we going to treat this different and difficult type of dementia? For dementia with Lewy bodies, the first thing to consider is don't give first generation antipsychotics, please. I repeat, when the diagnosis of dementia with Lewy bodies is suspected or actually made, then there should be a note on the chart. No first generation antipsychotics. Why? Because they are likely going to exhibit Parkinsonism or signs of Parkinson's disease. And when you give any of these first generation antipsychotics, you treat them to that because they're going to show all those features the more and worsen the situation for them. So first generation antipsychotics off the table. If you want to give the second generation neuroleptics, if at all you must, then please decrease the dosage. So you can give olanzapine, quetiapine, risperidone, clozapine, or aripiprazole at very low dosages compared to what you're going to give to other people at your clinic or hospital. So decreasing the dose of anti-Parkinsonia medications will be appropriate here. Never give anticholinergic to anyone you suspect diagnosis of dementia with Lewy bodies or the full diagnosis is already made. Cholinesterase inhibitors like rivastigmine or donepezil could be administered. The best choice to make here is memantine, which would be a better alternative to cholinesterase inhibitors. Melatonin is preferred when there is insomnia in anyone diagnosed with dementia with Lewy bodies. So the treatment is specific. We can't just give anything anyhow because while trying to help this individual, you can actually worsen the situation for them if you are not making the right choices. In conclusion, for now, I'm still going to make more presentations on dementia. I know you are waiting for Alzheimer's disease, but next will be differential diagnosis of dementia. Kindly subscribe to my channel so that you can get all these publications immediately they are released. Thank you.